ఇక కోవిడ్ విషయానికి వస్తే ఇప్పుడు నడుస్తున్నటువంటి ఒమిక్రాన్ థర్డ్ వేవ్గా చెప్పుకుంటున్నా దీనికి తర్వాత మళ్ళీ ఇప్పుడు పరిశోధనల్లో కొన్ని నియోకో అని ఇంకా కొన్ని వినిపిస్తూ ఉన్నాయి కదా, మీ పరిశోధనలు ఏం చెప్తున్నాయి సార్ కోవిడ్ మీద?
ఇట్స్ ఎ వెరీ గుడ్ క్వశ్చన్. దో యాజ్ ఎ సర్జన్ ఐ షుడ్ నాట్ టాక్ అబౌట్ కోవిడ్ బికాస్ ద ప్రాబ్లమ్ ఈజ్ యాక్చువల్లీ నౌ, అంటే ఇప్పుడు surprisingly the layman seems to understand more than the doctor sometimes actually.
Of course.
I'm really surprised actually. Sometimes you see the thing because their entire focus is only focused on COVID. So మొత్తం Google అంతా చదివేస్తారు. So sometimes you feel that their knowledge is more than what you're seeing. The later is sometimes they'll download the thing what is happening and then come here.
Yes.
But it's a good thing actually that keeps the doctors also in check. Actually now the biggest thing that has happened is actually now the patients are also asking whether yes, is it an apt treatment to be given or not. That's a good thing that has happened actually. One thing I really appreciate actually, I mean is good in a way, bad in a way, but actually the patients are also aware దేనికి ఇస్తారు, ఎందుకు ఇస్తారు, ఎప్పుడు ఇవ్వాలా, దీని కాన్సిక్వెన్సెస్ ఏంటి, దీని ఎక్స్పెండిచర్ ఏంటి ముందే తెలిసిపోయింది వాళ్ళకి. అన్లైక్ ద అదర్ ప్రొసీజర్స్ వాట్ హెస్ హ్యాపెన్, ప్రొసీజర్ అయిన తర్వాత ఇంత ఖర్చు అవుతుందని మాట్లాడదు. ఇదైతే ఎవ్రీబడి ఇట్స్ అన్ ఓపెన్ సీక్రెట్ దట్ ఇదేం నాట్ ఎ క్లోజ్ గార్డెడ్ సీక్రెట్. Yes, actually now initially we had some vaccines gurinchi we had some data. Ante booster dose ki same vaccine ivala, different vaccine ivala anadi. This was a controversy actually. We have lot of data. The government of India has given a thing that we have to give the same vaccine.
Okay.
There are some centers which say they can change the vaccine. We have also some data. Ma దగ్గర నుంచి కొంచెం data ఉంది actually. So like that we have lot of things actually which have come into the thing actually, and still they are working actually. Today evening again we have one, we take this to the public. This actually we have a webinar which is happening today evening again at 5 o'clock to take what's the latest that is happening, how we are treating and how patients are getting better.
Yeah, exactly. How you are treating అనే విషయానికి వస్తే సెలబ్రిటీస్ కానీ, పాలిటీషియన్స్ కానీ, లేకపోతే సామాన్యులు ఎవరైనా కాస్త ఎఫర్ట్ చేయగలిగిన వాళ్ళందరూ కూడా ఏఐజీ వైపు పరుగులు తీయడానికి కారణం ఏంటి?
యా యాక్చువల్లీ మాకు వచ్చిన ఫీడ్బ్యాక్ యాక్చువల్లీ ఓకే ఫైన్, మాకు వచ్చిన ఫీడ్బ్యాక్ ప్రకారం యాక్చువల్లీ, అండ్ వీ ఆల్సో బోస్ట్ ఆఫ్ అదర్ సర్ప్రైజింగ్లీ మా దగ్గర ద మార్బిడిటీ మార్టాలిటీ వాజ్ వెరీ లెస్, బేసికలీ బికాస్ స్టాండర్డ్ ప్రోటోకాల్స్ ఫాలో చేసాము. సెకండ్ థింగ్ వాజ్ the cost, we kept it at the bare minimum. It is not because of any VIPs. We have general, actually if you see, obviously only celebrities because all this admit of people know about it, but if you see we have a huge general ward and we have a free ward which runs the thing.
సెలబ్రిటీస్ పాలిటీషియన్స్ రావడం వల్ల నార్మల్ పీపుల్, కామన్ పీపుల్ ఓ ఇది మనం ఎఫోర్డ్ చేయలేనటువంటి హాస్పిటల్ ఏమో వీళ్ళందరూ వెళ్తున్నారు కదా అనుకునే
concept actually I think this is not the concept actually. The feedback that we get actually,
okay,
they said actually in the last COVID, the first phase of COVID, second wave, we have very positive feedback from all our patients.
Yeah,
we have a huge, I mean it's not that I'm talking offhand that this is the most reasonable hospital in it.
Oh, very nice.
That we have adequate.
Yeah, నేను కూడా విన్నాను. మీ ద్వారా తెలిస్తే
that's the feedback we get actually.
Okay.
So I mean obviously we know actually నాకు కూడా తెలుసు ఎందుకంటే the prices whatever is available we passed it on, and it is basically the biggest thing that has happened was we got a lot of philanthropic support from a lot of people, named, unnamed, a lot of people donated a lot of things actually. So the cost of delivery of the healthcare we could keep it at the bare minimum.
Okay, sir.
See, like ventilators were donated by somebody, some other things were drugs were donated by some companies actually who came forward to donate. So we were able to deliver the thing at but the cost could have been still lower but for the human resource which was the biggest problem. Most of the thing actually because most of the people fell sick, and people working in especially during first second wave actually the remunerations were I mean obviously people staff were working, they have all been remunerated very high. So those things were the things which are responsible for the pricing. Otherwise okay, it is not
Very nice, sir.
Obviously, because of
Then,
the disposables use, and you also know the thing actually, disposables when initially came were very expensive.
Yeah,
You
PP
talk
kits
about
like that.
N95 mask, which it used to be sold in black for some
Exactly.
time back. It's now freely available. Anybody can get it.
Exactly.
It's at a throwaway price right now.
Yeah,
So,
exactly.
so like that actually now actually the initial pricing basically because of non-availability and all could be, but now
Yeah. Finally, what are your goals from AIG?
we actually this entire hospital was set up with a different motto. Actually, as I told you, to deliver this healthcare at a very low cost, get the best of the care, and obviously develop a research wing also to an extent which becomes one of the best research facilities. We are expanding actually, obviously. We will take the specialities to a new level. We have a lot of things in mind, and actually there are a lot of technologies that are available that are coming into the market. So one, I'm sure on the gastroenterology side will change the face of diabetes management.
Okay.
We'll get pancreas, kidney transplantation, make it one of the few centers that will start the thing actually.
Okay.
Small bowel transplantation is another thing that is very important in our part of the world. We'll make sure that is. Second thing that we, parallel to this, with the help of the basic scientists, we should be able to develop some artificial hearts, artificial pancreas, which are going to be very beneficial.
Okay.
Personalized medicine is going to be a big thing, which I'm sure is robotic surgery is another thing that is very important actually. Right now the entire robotic surgery is concentrated on the Da Vinci part, but taking it on the endoscopy side is a big thing actually. So actually, in fact, I don't know whether you know, we are the first ones to, the first ever endoscopic robotic surgery was done in AIG hospital in the world.
Oh.
So that we are working on the thing actually. And there is a separate innovation department here, which we are encouraging all the doctors to go and take part actually, wherein a lot of engineers are working on a lot of products. I am sure that we'll have a lot of patents which are going to come in future. And I'm sure the whole concept of this multidisciplinary concept wherein all the specialties working together would really improve the overall results in any specialty, be it be gastroenterology, cardiology, any of this thing. I think we are taking oncology care to the next level actually. We have our own plan. We have, because of the support from the basic science lab, we have a very good move forward plan to take oncology to the next level. A lot of plans in the thing which some which can be disclosed, some which cannot be disclosed, but we are very thankful. I believe in God actually. We are very thankful that what we thought would take quite some time to translate it into reality has become a thing, basically because of team effort actually.
Yeah.
And the vision behind it, Dr. Aishwarya who keeps pushing it actually, and the team is very important. The person who's driving the thing, Reddyar, is very important, and I think all of the new people who are joining us also, they're getting into the same groove of research, publications, and I think we are one of the few centers in the country with the maximum number of publications.
Oh.
Actually, in fact, there are two new surveys which are done, which Newsweek has rated us as the best hospital in the country, and in the South Asia.
Okay.
The Week magazine has rated us one of the. These are things that come as a side, this thing that we feel proud of. But I think we'll have.
So, మేము కూడా ప్రపంచవ్యాప్తంగా 9 million subscribers తో ఉన్నాం కాబట్టి definitely
just keep watching AIG. I can just say, keep watching AIG.
Yeah.
And we'll have more things to come, not only in gastroenterology but.
So finally, వరల్డ్ వైడ్ గా ఎన్ని కంట్రీస్ లో మీరు సర్వీసెస్ ఇస్తున్నారు సార్?
Very good question actually. See, this India has become a thing for medical tourism right now. Accepted. Basically now there's a survey conducted which shows that the medical tourism is very viable in Singapore and Thailand. Basically these two are now, but the biggest advantage that India seems to have is basically the cost. If you see the medical tourism cost, they feel that India can still be lower. But actually, there are several issues to this actually. Basically, connectivity, India, how it is projected outside. See, these are all various factors actually. So, manaki medical tourism to become the main to compete with some of these other countries is going to take some time. It takes lot of effort to. So, we'll be happy to deal with those medical tourism, but actually at the same time actually our main goal is to treat our own patients. We have a lot of people who cannot afford actually, but one thing is for sure actually, we have not refused any patient who came to the doorstep of AIG on financial grounds. As far as I am concerned,
Okay, sir.
on any ground actually, people coming here maybe they have this apprehension, but we have never refused any patient because of one, everybody is full-time salaried here, working here. Two, lot of philanthropic
Yeah.
support that we get from the
Okay.
various organizations.